Good afternoon, everybody. Before I start, I would like to acknowledge my elders, my ancestors, my teachers, and my mentors, without whom I will not be here today. I also want to thank the REITs and AACE for allowing me to do this. My study was in India. There are about 34,000 women diagnosed, and cervical cancer being the two most leading cancers. With about 81% overall 5-year survival, just my state alone, Karnataka, which is in the southern part of India, would have more than 137,000 cancer survivors any given year. However, in India, we have no active follow-up for patients after treatment. And almost nothing is known about their psychosocial and mental health or overall quality of health. So my project was actually to examine the psychosocial needs and quality of life issues of breast and cervical cancer survivors using a community-based participatory research approach called PhotoVoice. What is PhotoVoice? It's essentially a participatory action research method that involves placing cameras in the hands of the participants so that they may visually represent and communicate to others their lived experiences. The goals being to record and reflect personal and community strengths and concerns, promote critical dialogue and knowledge about important issues, and to reach policymakers and decision makers to influence a positive social change. So what we did is we invited 23 female survivors to participate in our project, and we have them take 3 pictures which they would like to share with the group. When they came for our first session, they showed us the pictures that they had taken, and we used a methodology called SHOWed, which means each picture we would ask, what do you see here? What is really happening here? How does this relate to our lives? Why does this condition exist? What can we do about it? So for each picture, we would analyze using the SHOWed methodology, and then we would reflect on those themes as a group. In total, we had about 60 pictures that were selected over a period of time. And then we chose the top 60 photographs, and we agreed on the themes and the group statements that would come out from each of these shots. And then we reflected on the whole process. We discussed advocacy and knowledge translation initiatives. So what did we find? Based on the 4 sessions, we had about 4 different groups happening 4 times. There were 3 overarching themes that emerged from these data. Lack of knowledge regarding cancer recurrence and future treatment. Women were asking very simple questions. What do I do after my treatment? How do I prevent it from coming back? Simple things that we could have addressed. Lack of social support post-treatment. They didn't know whom to talk to. They didn't know how to get this information. They didn't know how to reach other people or share what they were going through. And the big one that really bothered me was fear and stigma about cancer. It was almost literally women and their families were being completely discriminated and separated from their social communities because of the fact that there was one person in the family who had cancer. So we really need to do something about destigmatizing the word cancer itself. And even the word survivor, they did not like the word survivor. They said, why are you calling me survivor? When somebody has some other disease, we don't call them survivors. So why are you calling me? Do you mean I should be dead? I think that's a fair point for us all to talk about and reflect on. Why are we calling them survivors? What would be the better word to use? These are some of the things we, even the educated ones, we need to be talking about, because we have our entire theme is cancer survivorship. I'm talking about it tomorrow in the cancer survivor theme. But the women I spoke to don't like to be called survivors. So what do we do about it? So I'm not going to go over all the results, just a couple. There was a big difference between rural women who were coming from rural communities versus urban. Rural women faced more financial stress, and most of their treatment costs were taken care of by getting loans from women's self-help groups or selling their assets. Lack of knowledge about government health schemes was very evident. On the other hand, urban women had better financial support from health insurance, employee state insurance, and central government health schemes. Here was a woman who got her neighbor to take this picture, and she said, "This picture shows me hugging my goats. I used to get emotionally depressed during cancer treatment. I needed to hug someone and cry, but I had no one. These two were my companions." She's talking about the goats she's holding. "But unfortunately, I had to sell them to raise money for my treatment." She had nobody to hug and hold and cry. A very simple thing. And like I said, stigma and body images are a huge issue. There was surrounding cancer, which was seen both in rural and urban settings. The necessity of maintaining secrecy surrounding cancer diagnosis was observed more so in the rural setup than in the urban setup, because if something happens in a rural community, everybody comes to know about it. Urban, at least we don't know our neighbors, as well as if you're in a village, everybody knows everybody. So here was a woman who said, "I bought a wig before my therapy itself, so no one would know that I have cancer. As I will not be accepted, I was very hesitant to go out and meet people. I pushed myself very hard to come out of my shell." Hair is a very, very important asset for an Indian woman. We are looked down on if we don't have good hair. And for women to have to lose their hair and go out into the public is not an acceptable thing. So that is another aspect that women have to deal with. This was very positive. This was a lady who had just gone through the whole treatment and she's doing well. She said, "It is me in the advertisement. I'm proud to be the face of survivors in the Bharat Cancer Hospital banner. I'm standing below the banner in a pink dress indicating pink hope. With good support and treatment, we can defeat cancer." We need more stories like this. We need more people coming out and sharing that cancer is not a death sentence. So this is the direction I'm heading in. So call to action, we're trying to disseminate knowledge and awareness about cancer to help reduce cancer stigma, help with navigating through the healthcare system, especially for rural female cancer patients. We want to figure out how we can help with financial literacy to avail the government health benefits that's available to all but not accessible, and empowering the survivors in income-generating activities to reduce financial stress. So when we finished all this, we actually had these pictures as a photo exhibition, and we invited all the stakeholders and policymakers. This is the first citizen of Mysore. He's the mayor of Mysore. We got him to come and we showed him everything that was happening. We got him to meet some of the participants who had taken part in the study. We also invited the sub-district medical officer to come and hear what these women were talking about. And this picture, the lady in the off-white sari, she is a retired professor. And for the first time in her life, she talked about her cancer treatment. And that was empowering to her as well. And the gentleman on the left is a president of one of the largest universities in Mysore. So he committed to making sure that there were counseling services and peer navigation available when their programs start. And to end, this was the lady who had lost her goats. So instantly we raised money. We bought her the 2 goats. We bought her fodder for a year so that she doesn't have to spend money. So she has somebody to hug. Everybody needs somebody to hug. And we had the mayor. He committed to increasing resources in Mysore to help with screening and helping our organization to help the state in getting more screenings done. And none of this would be possible without my awesome colleagues who are in that picture. I'm just presenting all this on behalf of my wonderful colleagues with whom I have the privilege of working every day. Thank you so much.